Welcome to SVG-TV News for Thursday, October 7th, 2021. I am Rochelle Beache with the details. 99 new COVID-19 positive cases were reported from 517 samples processed on Monday, October 4th, 2021, resulting in a positivity rate of 19.1%. A release from the National Emergency Management Organization, NEMO, said one imported case was detected in a fully vaccinated passenger from Denmark, and 2 other cases were detected on exit screening. All other cases are contacts of known positive cases and persons seeking care. There are currently 23 patients admitted for COVID-19 at the Argyle Isolation Facility. 21 are unvaccinated and 2 fully vaccinated. 21 patients have also been admitted to the COVID-19 wards at the Milton Cato Memorial Hospital. 19 patients are unvaccinated and 2 are partially vaccinated. 3 new recoveries were noted over the reporting period. 1,400 cases are currently active and 33 persons with COVID-19 have died. 3,965 cases of COVID-19 and 2,532 recoveries have been recorded in St. Vincent and Grenadines since March 2020. The health authorities say, in view of the confirmed presence of the Delta, Mu, and Gamma variants in the community and a significant increase in the number of new infections, transmission, severe COVID-19 disease, and deaths, strict enforcement and compliance with all protocols and recommendations by everyone is strongly recommended. It has also been noted that the correct and consistent use of masks, avoidance of crowds, physical distancing, proper hand sanitizing, and immunization with available vaccines have all been proven to significantly reduce the risk of getting infected, sick, and or dying from COVID-19. Meanwhile, Chief Medical Officer Dr. Simone Keizer Beache has expressed concern with the rate of COVID-19 infections in the country, noting that she does not see it slowing down anytime soon. On a program on VC3 last evening, the CMO said the daily positivity rate is high except on a Sunday, which she said is generally a slow day for testing. SVG now has 1,400 active COVID-19 cases with more than 15 deaths in the last few weeks, which the CMO said is worrying and is urging people vaccinated and unvaccinated to double mask and to follow all of the COVID-19 guidelines or protocols.
I am looking at the figures daily, looking at the amount of testing, the contact tracing that's going on, and I'm not seeing at this point any sign that we are flattening the curve. Rather, it's an exponential. And we know that as we do that exponential rise, as happened in Grenada, even look at Barbados. Barbados was pretty fine for quite a while, and now they have gone right back up. You're seeing deaths again. So I'm going to say that we are very concerned. We urge the vaccination. We ask persons to really use your mask. We're dealing with Delta, Gamma, and Mu. So you should be using your double mask. Even your vaccinated persons, we should be double mask. We should be using properly fitted masks, and we should be seriously looking at if we are using cloth masks, we should be double, or we should be using N95 masks. So we are even more protected than before. That's the only way we're going to cut this. We have to be masked, we have to be distanced, we have to be sanitized, and we have to be vaccinated.
Making a comparison to neighboring Grenada, the CMO said similarly, SVG can expect to see the figures skyrocketing, pointing out that the country's vaccination rate is the lowest in the OECS and that the health system is now overwhelmed.
Also has a much higher, compared with us, level of vaccination. So they had a much more protected population than we have. So we are looking and we are looking at these figures with great concern, because already, as you said, We are looking at our hospital where we have had to utilize two wards. So we have already, fully occupied our Argyle isolation facility. Then we had to move into the Milton Keynes Memorial Hospital, take over the female medical ward, take over the pediatric ward, and we are now looking at moving to a third ward at the MCMH. Because we are seeing more and more cases coming in, needing more and more care. And that's a significant blow to our capacity to offer other types of care.
The CMO said that the outbreak of COVID-19 in SVG is clearly from among the unvaccinated.
Unfortunately, we're dealing with the Delta variant. So somebody who was fine in the morning, speaking normally, suddenly by the evening can't breathe, and by the time they get to hospital, they are extremely ill. And that's what we are seeing, that some of these people come in with very low oxygen saturations. You've heard about that. That's the amount of oxygen that's circulating in the blood. They come in very ill and they deteriorate very quickly. And so we are really asking persons that even if you have a little runny nose, you have a little cough, you get checked to make sure this is what it is. And even while you're at home, especially persons with pre-existing conditions, if you notice at any point that, you are vomiting or you have diarrhea that's not settling, you're feeling suddenly much worse, we ask that you seek urgent care. But the nature of COVID is that it is, and this is something that's been reported repeatedly, that persons can go from stable to completely unstable and die in a very short space of time.
Following the death of an individual who was partially vaccinated, the CMO is advising persons not to wait until they come into contact with someone who is COVID-19 positive to take the vaccine. Dr. Beache appealed to members of the public not to risk the opportunity of taking the vaccine a little too late, noting that persons are now finding themselves at the various health centers to get vaccinated after they come into contact with someone who is COVID-19 positive.
Persons who died had recently had a vaccine. And not sure if this is what it was, but we are seeing this where some persons, they realize they might have been exposed and they run quickly to get the vaccine. I want to remind persons, you don't want to wait until you have been exposed, because you have to have first dose and then a second dose. Typically, that second dose, the earliest is 3 weeks if you're dealing with the Keizer or the Sputnik. And then you have to have 2 weeks after that before you have your maximum amount of protection. Okay, so we are encouraging persons not to wait until the person next to you in the office tests positive and then you run off to get your vaccine. We want you to go and get it now. We are seeing the benefits.
Dr. Keizer Beache said that fully vaccinated persons have been admitted for COVID-19 but are recovering, which shows that the vaccines do help people from getting seriously ill.
We had a 74-year-old female who was on the ward for 2 weeks, COVID positive, and she's been discharged today. And she's vaccinated, she's fully vaccinated, and she's going home and she's well. And the difference between a 74-year-old, who we know is a high risk or a poor outcome relative to somebody who is much younger, 47, say, and the difference there, a significant difference, proven by evidence throughout the world over time, is the vaccination. That's one of the things. So we really encourage persons to go ahead and take your vaccine as soon as possible, and we have a wide range of vaccines available. And even if you have a contraindication to one type, you can have the other.
The CMO outlined the timeline given for persons who have been exposed to COVID-19 and or were partially vaccinated to take the jab.
It can take up to as early as 1 month after your negative result, you can take it. But the advice varies. Some persons will say 1 month after the positive result, some persons say 1 month after the negative result. And I know there are some physicians who have given, as soon as somebody has a negative result, you get your second dose. Or you go ahead, if it's first, you get your first dose. I just received early this morning, received an article from a colleague and reminding persons about the evidence which supports the fact that even if you have been infected, the immunity that you get from that infection is inconsistent. So I might have a very good response. I might have a very poor response. And also the antibodies that you produce coming out of an infection, they don't last that long.
Consultant and urologist Dr. Rohan Deshong said that misinformation about the COVID-19 vaccines is one of the reasons for the high level of vaccine hesitancy in the country. Dr. Deshong, who is fully vaccinated, said that too many times people listen to persons who are not qualified to speak on an issue, and some people do not believe what the Ministry of Health is putting out to the public.
And there are even those who are doubling down and trying to misrepresent what's going on. There are those who are saying, oh, we have escalated the figures to make people frightened. If anything, I mean, my CMO would agree with me, we tend not to escalate the figures. We have a fairly high threshold for calling a death a COVID death, to the point that sometimes I think we put the bar too high. So it's facetious that people will think that we are elevating the numbers just to make persons frightened to go to get vaccinated. And then you hear the other flip side of the coin. Trust me, people take the information and misinterpret it in whichever way they can, including even the information about the vaccine.
Dr. Deshong expressed dismay at some people who are still refusing to be vaccinated, noting that it is unfortunate that people have to die from COVID-19 when vaccines are available.
Because we've had a lot of time to, as my Facebook friends would say, do our research. We've had a lot of time to ask questions, to be skeptical, and it's unfortunate. I made a post on Facebook a few days ago and said there was no need for Vincentians to be dying in the presence of an effective vaccine. It's unfortunate that when I think about it, it makes me angry, so I tend not to want to talk about it, because it tells us the power of words, the power of misinformation.
SVG was today added to the list of countries for which fully vaccinated travelers are exempt from quarantine in the UK. According to the Searchlight newspaper, a diplomatic note from the British High Commission to the Ministry of Foreign Affairs, Foreign Trade in SVG said a fully vaccinated traveler is a person who has received 2 doses of the AstraZeneca, including the Covishield, Pfizer, Moderna, or Janssen vaccine, with a second dose being at least 2 weeks prior. The diplomatic note said the government of the United Kingdom has now assessed the documentation and information provided, and St. Vincent and the Grenadines has today been added to the list of countries that have been exempted. The exemption for SVG comes into effect from 4 a.m. Monday, October 11th. Passengers returning to the UK from these destinations will no longer be required to enter hotel quarantine. Travelers are asked to note that the entry rules in the UK are subject to change on a regular basis, and it is important that you check the website www.gov.uk before travel. The diplomatic note said it is feasible that the list of vaccines may be expanded in the future, but for now the list is restricted to the 4 AstraZeneca, including the Covishield, Pfizer, Moderna, and the Janssen vaccine. In other news, the Family Support Grant Psychosocial Training by the Ministry of National Mobilization and Social Development has been postponed with immediate effect to Thursday, October 7th, 2021. The ministry said the postponement is due to the continued rise in COVID-19 cases across the various communities where the program is being conducted. It is anticipated that the program will resume on Monday, October 25th at the various places where the program is being done. The psychosocial support training is a collaborative initiative between the government of St. Vincent and the Grenadines through the Ministry of National Mobilization and UNICEF as part of the Family Support Grant. With reviews from schools and teachers, President of the SVG Teachers Union, Oswald Robinson, said the report received has indicated that only about 50% participation in the virtual classes has been registered due to poor internet connection. Schools across St. Vincent and the Grenadines started the new academic year virtually on Monday, October 4th, and this method of teaching and learning is expected to go on for the next 2 weeks. For Phase 2, which may include face-to-face classes, this will be dependent on the country's COVID-19 situation and whether the school can accommodate physical distancing.
Now, the online classes has been 50% from the feedback we have been getting. There are schools that, again, it depends on the reliability of the internet, accessibility of the internet. Because very early on Monday, there were parents who were logged in and were waiting. And then there, on the other hand, there were some schools where teachers were logged in and waiting for, because there has to be a transition, because you're moving students now to a new teacher or teachers. So there was a little bit of hiccup here and there, you know, but in the end, some people were able to get it right.
Robinson is urging the internet providers to improve their service so that the students and teachers can engage properly in their online classes.
It takes a little time because there are students who may have to reset password and that sort of thing. They may have to be using a different device. In some cases, you have a situation where some students could not have got into the platform. A lot of that has to do with the reliability of the internet, the technology. So the internet product providers need to do something about that. I know for sure that there's a package that the Ministry of Education worked out with Digicel, where you pay $20 every month and you're able to have data on your phone. Okay, but when the electricity goes, what's going to happen?
The SVG-TU president also noted that teachers continue to do their best in providing quality education to their students amidst the challenges they are facing.
Our teachers would have tried. There are still some challenges in their way because they also have their own children to deal with and they're teaching from home. From the parents' point of view, I've heard parents saying that they have to go to work, they have one cell phone, and how are they going to monitor their children at home? Especially the grade K and the grade 1s, because those did not have. I know some parents made that sacrifice the last time to just leave their cell phone or their tablet at home for their children and have somebody supervise them. I know that the ministry said that they are going to solicit these devices and get them, and because of the whole COVID situation, they're working on it. And we take them at their word when it comes to that, which is good news.
In some police news now, we heard that Rosalo Andrews, a 37-year-old farmer of Green Hill, have been arrested and charged with the offense of wounding. The accused man allegedly, unlawfully and maliciously wounded a 60-year-old male laborer of Old Montrose by striking him on the left shoulder and left middle finger with a piece of steel. The incident occurred on Monday, October 4th in Green Hill. Andrews appeared at the Serious Offences Court today and pleaded guilty to the charge. He received a 6-month suspended sentence and was ordered to pay compensation of $400 to the virtual complainant by October 22nd or 1 month in prison. In another police matter, Shaheem Belgraves, an 18-year-old laborer of Rose Place, was arrested and charged with the offense of possession of an unlicensed firearm and ammunition. The accused man allegedly had in his possession one Smith & Wesson .38 revolver and 5 rounds of .38 special ammunition without a license issued under the Firearms Act at Rose Place on September 30th. The accused appeared at the Serious Offences Court today and pleaded not guilty to the charges. He was granted bail in the sum of $12,000 with one surety. He was also placed on a curfew from 7 p.m. to 7 a.m. and must report to the Central Police Station every Monday and Thursday between 6 a.m. and 6 p.m. The matter was adjourned to October 25th for trial. Meanwhile, the police have arrested and jointly charged Clinton Kittels, a 29-year-old porter of Fountain, and Dexter Brown, a 23-year-old porter of Camden Park, with the offense of theft. The accused men allegedly stole several items valued at $525 EC and 73 cents, the property of Couriers Distribution Limited at Lower Bay Street, Kingston, on Tuesday, October 5th. The accused men appeared at the Serious Offences Court today and pleaded not guilty to the charge. The matter was adjourned to January 10, 2022 for hearing at the Kingston Magistrate Court. The suspects remain on station bail.